is Aaron Lanza. I'm the Senior Director of Clinical Applications at Mission Bio, where we're developing tools that are helping scientists understand what's happening in each individual cancer cell, which is enabling us to learn how to better treat and eliminate cancer. Now, I'm also a lymphoma survivor and an active participant in the oncology research, the patient support and survivorship communities, as well as the charity communities. And I've additionally served on the executive leadership committee for the Leukemia and Lymphoma Society, which is a major funder of cancer research. So cancer is a tough but very important topic that should be talked about. And I'm here to share the 5 things that I believe everyone needs to know about cancer. So the first is that many cancers are actually preventable. And in my work, I spend a lot of time thinking about how we could one day actually detect and then intercept cancer precursors before they develop into tumors. And I hope to materially contribute to those discoveries. Today, we know that some cancers are hereditary, meaning there are genetic traits that are inherited from one or both parents that may predispose someone to a particular type of cancer. However, many cancers are actually preventable through healthy lifestyle choices and mitigation of environmental exposures, as these things can lead to acquisition of mutations as we age and as a function of the things that we do or consume throughout our life. And these things can increase our risk of developing cancer. So a couple great examples are the use of tobacco and alcohol, which are both associated with increased risk for many different types of cancers. Another is UV radiation from direct sun exposure, which can increase the risk of developing skin cancers such as melanoma. And then similarly, poor diet, lack of physical activity, obesity, these things can all increase risk of colorectal cancers, among other health concerns. Environmental exposures such as pollution, radiation, or chemicals are also important factors in lung cancers, lymphomas, thyroid cancers, and so on. And then finally, there's actually some infectious agents that can lead to cancer. And a great example of that is the human papillomavirus, or HPV, which can lead to cervical, anal, or oral cancers, among others. But fortunately, in the case of HPV, we actually have a highly effective vaccine. The second thing that everyone should know is that cancer is most treatable when it's caught early. So the sooner that a cancer is detected, the higher the likelihood that it can be successfully treated. So it's really important to listen to your body, know your body. Cancer screening tests are really still being developed for broad use in the general population for the specific intention of catching early disease. And there's been a lot of really exciting acceleration in that field. However, in the meantime, it's very important to understand your family's history of disease, and then based on this information, follow all preventative measures that are recommended by your doctor. So go to your routine appointments, follow up on all preventative screening tests at the recommended ages. This can include things like skin checks for changing moles, colonoscopies, mammograms, annual blood work, and so on. But above all, know your body and communicate with your doctor. Be vigilant and report anything that's suspicious or anything that changes in your body. I was 29 years old when I found a 2-centimeter lump in my neck. And I had experienced periodic itchiness and some night sweats, but nothing that I really ever thought could be tied to cancer. But unfortunately, by the time I saw a doctor and had a biopsy, it was stage 2 lymphoma, which I was still fortunate that that's considered early stage. And I was very lucky to have found the lump, and I quickly followed up on it with my doctor before it spread further and became more difficult to treat. So the third thing is get multiple opinions. And importantly, make sure that at least one of them is from an academic medical center. The cancer treatment landscape is evolving rapidly, and so much progress has been made in the last decade. But the reality is that there's really no one-size-fits-all treatment approach in many cancers. So the field has really begun to move from blanket chemotherapy and radiation strategies to non-chemo-based therapies that include things like new immunotherapies that enlist the body's own immune system in the fight against the tumor. And there's also targeted treatment options now that home in on particular tumor mutations that we can elucidate by sequencing now. And scientists are now even engineering immune cells that can be infused back into the body to find and fight those cancer cells. And this is a field where we're directly supporting through our work at Mission Bio, and is a very exciting space. But because advances are happening so often today, it's particularly important to include opinion from a doctor at an NCI-designated academic cancer center. These are the premier institutions where you will find cutting-edge clinical trial options, and they're more likely to have your particular case reviewed by a tumor board, which is really a panel that's comprised of multidisciplinary doctors that aim to leverage their collective hive mind, so to speak, to chart the best treatment options for a particular patient. The fourth thing is that you are your best advocate, and it's important that you understand your treatment options. So treatment decisions are often complex. There may be multiple options in front of you, depending on the stage of the particular disease or your case. And they're each going to entail distinct benefits and drawbacks. Cancer is not routine, and treatments are not one size fits all. So it can be particularly tricky if a biopsy is inconclusive or if a scan is unclear. One treatment approach might be more aggressive, but it might portend higher risk of lifelong side effects. Another option might be easier to tolerate with fewer side effects, but perhaps carries a lower chance of success or a higher risk of disease progression or relapse. So weighing the pros and cons, is rarely a straightforward exercise, and ultimately it comes down to the patient's decision. So, please ask questions and be informed about your situation. After I completed chemotherapy for lymphoma, all of my doctors agreed that I needed to pursue radiation as a final step, but they disagreed on the type of the radiation. So ultimately, I pursued multiple doctor opinions across multiple institutions, and ultimately I found a tiebreaker and made my decision after carefully understanding each of their rationales. This does require a lot of effort and dedication. It's not an easy process, but ultimately no one will push as hard for the right answer for you as you will for yourself. And the fifth and final thing that I wanted to share, and something that I've personally learned and experienced as a survivor, is that life goes on in spite of a cancer diagnosis. So as we get better at treating and curing more and more cancer patients each year, we have a quickly growing population of cancer survivors. And cancer survivorship is a really important field that considers the psychological, financial, and long-term health ramifications for patients that have overcome a cancer diagnosis. One of the most challenging aspects of survivorship for me was grasping the fact that life goes on. It's often an unspoken mental challenge to recover from facing a potentially terminal diagnosis and then trying to transition back to feeling normal again, replanning your life and reprioritizing the things that you want to accomplish. I was always concerned, for example, with what big life decisions could be impacted by the potential of a relapse, and I don't think that really ever leaves the mind of a cancer survivor. And for me, as a young adult, that meant questions like, can or should I start a family? Does it make sense to buy a house? Should I prioritize advancement in my career now? These can be really tough questions and tough psychological experiences, and it can feel lonely and stressful when facing the uncertain in life. But as I look back over the years since my own diagnosis, I reflect on how much I struggled with, wanting to start a family, but weighing the risks of what were to happen to my family if I fell ill again. Or for example, wanting to buy our home, but fearing financial impact if I faced further rounds of treatment and couldn't work. So I was really learning to balance the fear of taking steps forward in spite of the risk of falling back. But ultimately, regardless of a medical outcome, my learning and my takeaway was that life doesn't stop. And I believe everyone, especially cancer survivors, should get busy living your life, while we're always hoping for the best outcome. But it's important to say that cancer survivors are never alone, and it's important to reach out to support groups, fellow survivors, or professionals if you do experience sort of diverse challenges of cancer survivorship. It's always easier than said than done. But I sincerely hope it's helpful advice or needed encouragement from the perspective of a survivor. So those are my 5 things I think everyone should know about cancer, and thank you for taking the time to listen.